Today we'll discuss diuretic resistance. Diuretic resistance means failure to achieve the therapeutically desired reduction in edema despite full dose of diuretic. Diuretic resistance means failure to achieve the therapeutically desired reduction in edema despite full dose of diuretic. Or simple, we can say that edema refractory to a particular diuretic is called diuretic resistance. Means despite full dose of diuretic, that you are giving full dose of diuretic, but still reduction in edema is desired reduction in edema is not occurring. Means failure to achieve the therapeutically desired reduction in edema despite full dose of diuretics, and that is called as diuretic resistance. Or in simple words, edema refractory or refractory edema to a particular diuretic is called diuretic resistance. Clinically, we can say that poor response to the diuretic therapy and persistence of signs and symptoms of edema despite full dose of diuretics. Now, what are the various causes? Incorrect diagnosis. Incorrect diagnosis means that edema is because of lymphatic edema or venous edema. So, that will not going to reduce with the help of diuretics. Not restricted sodium or fluid. Sodium restricted diet is required for reduction in edema. So, that restriction is not yet done. So, not restricted sodium or fluid. Decrease glomerular filtration rate or decrease renal blood flow. These two parameters are very important. If there is decreased GFR and decreased renal blood flow, so the efficacy of diuretics will decrease or reduce. Then pharmacokinetic issues of the drug. So all these are the causes for the diuretic resistance. Then what we have to do to treat or to overcome the diuretic resistance, you have to increase the dose of diuretics. To overcome the diuretic resistance, you have to increase the dose of diuretics, you have to provide bed rest to the patient, and you have to administer this diuretic just before meal to increase the efficacy. And you have to use the combination therapy of diuretics which acts by different mechanism. For example, you have to combine loop diuretics with the thiazide diuretics. The best example is the furosemide with metolazone, and this furosemide along with metolazone means loop diuretic along with thiazide diuretics is the best combination to overcome the diuretic resistance.